Hello everyone and welcome back. So in this video we are going to discuss the steps of thyroid examination. So this is the step okay. Mm, okay. So the points for the examination of thyroid are more in number than any other short case in surgery and students often miss some important points. If you divide the thyroid examination into three parts, then it would be possible that you will not miss any important during your thyroid examination. These three parts are thyroid itself, the structures around the thyroid, and the functional status of the thyroid. So the thyroid itself, hmm, we are having the site, the extent, the shape, the consistency, the surface, the edge, and the movement with swallowing and movement with tongue protrusion relation with surrounding structures. Now the structures around the thyroid, we are having the position of the trachea, the cervical lymph nodes, and etc. And for the functional status of the thyroid, we are having the hypothyroidism, the hyperthyroidism, and the eye sign, etc. Now how you will examine the thyroid, the different steps are that first of all you have to do the greetings and then introduce yourself and then introduce the patient and then take the consent. So this is the greeting, that is Assalamu alaikum, I am Dr. Rish, and what is your name and how are you and can I examine your neck? Okay. After this, expose the neck and note following points on inspection of the neck. That is, any swallowing, its size, shape. Ask the patient to take a sip of water. Note the movement of swallowing with swallowing. Thyroid, thyroglossal cyst, move upward with swallowing. If swallowing is moving with swallowing, then it is small. Ask the patient to open his or her mouth and protrude the tongue. Thyroglossal cyst will move upward with this. Okay, first of all you have to do the inspection and instruct the patient to do the following steps and you will inspect. So what you have done, expose the neck and then note the following points, that is any swelling. Then ask the patient to take a sip of water and note the movement of swelling with swallowing, that is thyroid, thyroglossal cyst, which move upward with swallowing. If swelling is moving with swallowing and it is small, ask the patient to open his or her mouth and protrude the tongue. Thyroglossal cyst will move upward with this. So you can find that it is a thyroglossal cyst. Okay. After this step, observe the skin for scar, pigmentation, discharging sinus and neck veins. Then ask the patient to raise his or her arm above head and note facial congestion, that is Pemberton's sign. If the neck is short and thyroid is mild, perform Pezzilo's method. With this method, the swelling becomes more prominent for easier inspection. Ask the patient to place his or her hands behind the head and to push the head backward against clasped hands. So this was all the steps that is performed during the inspection. Now on palpation, palpate the neck from the front, then temperature, tenderness, size, position of the trachea. Palpate the lower border while asking the patient to swallow the check for retrosternal extension. Then confirm the findings of inspection. If one lobe of thyroid is enlarged, perform Leahy's method to palpate it. Palpate the neck from behind, that is stand behind the patient and place your thumbs on ligamentum nuchae and place the palmar surface of your fingers on each side of the neck and tilt the head forward, that is flexion to relax fascia and anterior neck muscles, and note the following points, that is surface and consistency. Now most importantly, try to find whether the thyroid diffusely enlarged or nodular. If it is nodular, it is solitary, dominant or multinodular. Perform swallowing test. Check sign of malignancy. Slightly push on the lateral lobe and note if any stridor develop, that is Coccus test. Then check carotid pulses, that is Barry's sign. Then palpate the cervical lymph nodes by up and down technique, which is described in detail in the next section of this book. Okay, on percussion over the sternum for retrosternal extension and auscultation is done for the thyroid bruit. Now check the signs of the toxicity, that is in palms and pulse. Hands for tremors. Ask the patient to extend his arms and spread the fingers. If any doubt exists, then place a small piece of pepper on the hands. Eye signs, lid retraction, lid leg, and Joffrey sign, Mobius sign, exophthalmos and ophthalmoplegia, etc. Pretibial myxedema, proximal myopathy. This is ask the patient to abduct the arms against the resistance and look for any weakness. Check the signs of the hypothyroidism, that is dull face, thinning of the hair, bradycardia, eyebrows, delayed ankle jerk, that is Waldman's sign. Cover the patient and pay thanks. low pitched voice. Okay, so this was the general examination for thyroid. This is the a description of multinodular goiter. Okay, so let's revise what we have studied in the thyroid examination. Uh, First of all, greetings are done, and then the introduction is done, and then consent is taken. Then you have to do the inspection. On inspection, expose the neck and note the following points. These are the points that are done in the inspection. Then palpation is done, that is palpate the neck from the front for the following things, and then the palpate the neck from behind for the following things. Okay, in thyroid examination, the neck examined or palpated from both front and behind. Check for the signs of toxicity and check the signs of hypothyroidism, and then do the percussion and auscultation. Auscultation is done for thyroid bruchi, and percuss over the sternum for rosternal extraction. Okay, this is the third and this is the fourth step in the thyroid examination. Now, how you will represent the case of the thyroid, that is the description of multinodular goiter. If it is multinodular goiter, then this is the important case or common case in surgery. So you will give the description as follow. This middle-aged lady presented with slowly growing swelling in the front of the neck for 10 years. The swelling is moving with swallowing but not with tongue protrusion, and the old line skin is not discolored, no scar, no pulsation, but prominent engorged veins are visible in front of the neck. Temperature over the swelling is comparable with the surrounding and it is non-tender. Trachea is in central position and it is about 7 into 10 cm. Nodular swelling have firm consistency, moving with swallowing, and has no retrosternal extension, as I can get below the swelling. Skin over the swelling is mobile and swelling itself is mobile over the deeper structures. There is no sign of tracheal compression. Carotids are palpable at their normal anatomical sites, and there is no cervical lymphadenopathy, and there is no sign of hyper or hypothyroidism. Note: it's better to take water bottle with you because patient is asked to swallow 3 or 4 times by a student, and at the end patient gets irritated with dry mouth. If you will offer him a glass of water and take a sip of it for swallowing, it creates a good impression and the patient further cooperates with you. Okay, so this is the important step or the important clue for a thyroid examination. There should be a water bottle with you. So we have discussed the thyroid examination. In the next video, we will discuss the uh, steps of examinations of the neck swelling excluding thyroid.